I'm a clinical oncologist, which means I deliver both radiation and chemotherapy treatments. And the main tumour sites which I treat are tumours in the head and neck, which is mouth and throat cancer, thyroid cancer and lung tumours. I specialise in treating patients with the Cyberknife. I was one of the first people in the UK to be trained, having done my training in the US. The Cyberknife technology is very new. It's taken advances in robotics and advances in computer-controlled technologies and applied them from really what was previously manufacturing process into being able to use the technique to deliver radiation to cancer patients. One of the advantages of the Cyberknife is it's able to keep the radiation dose very tightly controlled in and around the tumour and minimises the dose that's delivered to the normal tissues which are close to the tumour. And by doing that, hopefully it will reduce the long-term side effects of radiotherapy. The purchase of a machine is around about £2 million. Typically, patients can be referred either directly from their general practitioner or they can be referred by another specialist. So, for example, I get a lot of referrals from specialists in ENT, ears and throat surgery, who diagnose the type of cancers that I treat. Typically, I'll see the patient for the first time and evaluate what's been done so far in terms of investigations, and then the patient will normally start the treatment, typically within 2 weeks or so of being seen for the first time. As part of the diagnosis and the assessment of any patient with cancer, CT scanning is one of the most common investigations which is used. And typically that's used to define exactly the position of the tumour, its size, its exact anatomical location, to see if there's been any spread of the tumour to other parts of the body. So this is a scan of a patient who was referred to me with a tumour in the head and neck. And what I'm looking at on this scan is the position of the tumour, how easily visualised the tumour is in the head and neck region. What we can see here is there's quite a small localised tumour in a very difficult place just behind the back of the nose, which is difficult to treat with standard forms of radiotherapy. If a patient looks as if they're suitable for Cyberknife treatment, then they will be reviewed by a Cyberknife team, which is a group of specialists who are experienced in this treatment. There's then a period of a week or two where treatment planning and preparation for the treatment is performed. The treatment planning process is a computerised process whereby we import the CT scan into a computer. The computer then will calculate how the radiation needs to be given in order to successfully treat that tumour. And then the computer will give a series of instructions which then can be programmed into the robot to deliver the treatment to that particular tumour in that patient. Most Cyberknife treatments are either one treatment or up to 3 or 5 treatments, and typically that could be given over a period of a week. Some of those patients that we're treating with that short treatment on the Cyberknife traditionally may have been treated with radiation which was given day to day, Monday to Friday, for 6 or 7 weeks in the past.